Hello everyone, welcome to my channel Medicine Medici. I'm Dr. Asma, ACVPU. In this video, I'm going to talk about one of the most important part of emergency patient assessment, that is ABCDE Protocol. And this is a structured protocol to approach to a patient. Usually, it is the first encountered part in ALS exam. Now let's talk about what it stands for. ABCDE. A stands for airway, B for breathing, C for circulation, D for disability, and E for exposure. This is a structured method, so you cannot jump from A to D or E. You have to follow the sequence. Now, if the nurse informs you that there is an unwell patient and she wants you to review the patient, in such a case, you have to proceed the case with ABCDE approach. And first of all, you have to take your personal safety measures. Then start with A, that is airway. In the airway, you have to look whether the airway is patent or not. Look for any snoring, secretion, or foreign body. You can use the sucker to clear the secretions, and if there is any accessible foreign body, then use the McGill forceps to remove the foreign body. You can do head and neck maneuvers. You can do head tilt, chin lift maneuver. And if there is any suspicion of possible spinal injury, then don't go for head tilt and chin lift maneuver. In such a case, you have to do the jaw thrust maneuver. After doing the maneuvers, if it happens that your patient's condition is still not improving, in such a situation, you can consider for nasopharyngeal airway insertion with appropriate size. Then you can consider about oropharyngeal airway. Attach 15-liter oxygen with non-rebreather face mask. If still no improvement, then you can consider for assisted ventilation. You have to look for your patient's respiratory effort. If there is shallow breathing and respiratory rate is low, then consider for assisted ventilation. You have to insert eye gel, supraglottic airway insertion, and you have to attach ambu bag along with this. You can attach waveform capnography circuit with it so that you can create a closed loop circuit. Now go for B, breathing. Here, look, listen, and feel for any possible sign of respiratory distress. You have to check the respiratory rate, tracheal position, and whether there is any asymmetrical chest wall movement. You have to auscultate the lung fills, and you have to attach the pulse oximeter to check oxygen saturation. Look carefully patient's breathing effort and whether there is any use of accessory muscles. Now go for C, that is circulation. Check your patient's pulse, that is radial pulse. Then go for blood pressure check and CRT, capillary refill time. You have to check the capillary refill time by pressing over the sternum. Then check the temperature and urine output of your patient. If he is not already catheterized, then catheterize your patient. Open to whiteboard channel, collect blood sample. You can start IV crystalloid saline solution. You can consider fluid bolus where it is necessary, and do a ECG. Now go for D, disability. Here, you have to check the patient's conscious level with ACVPU. Check your patient's pupil and blood sugar level as well. You have to check carefully about your patient's drug chart. Then go for the E, that is exposure. Expose your patient properly and look for whether there is any bruise, rash, swelling, any sign of injury, or any sign of hemorrhage from any parts of the body. At any stage, if your patient develops cardiac arrest, no response, no breathing, no pulse, then you must follow the cardiac arrest algorithm. That's it for today. See you in the next video. Till then, stay safe, stay well.